Hi, my name is Dr. Cheryl Chrisman, and I'm a neurologist at University of Florida. And we're here today to talk about how to do a neurologic examination. With me, I have Amy Reynolds, our neurology technician, and my dog, Wings, treasure of my heart. And we're going to demonstrate for you what the proper way to do the neurologic examination is. First off, we have to talk about what is the purpose of the neurologic examination. The purpose of the neurologic examination is first off to determine, is there even a problem of the nervous system? And if there is a problem of the nervous system, the second question we want to answer is, where is it? Sometimes if we can just know if it's above the level of the foramen magnum in the head or below the foramen magnum in the spinal cord, peripheral nerves and muscles, that can really help us to focus the rest of our diagnostic tests. The third thing we want to determine is, how severe is this lesion? Is it mild? Is it moderate? Is it very severe? Because that helps us with our prognosis. And lastly, when we do the neurologic examination, that gives us a basis to do future neurologic examinations so we can follow the course of the disease process. So lots of times what's very helpful when you're first starting out is to actually have a neurologic examination sheet. And this is the sheet that we use at University of Florida. The tests that are listed on the front are those that involve the head or above the level of the foramen magnum. And the back is the gait, some postural reactions, some spinal reflexes and sensation testing. So we'll follow this along today, and so that you remember to do all the tests, and you kind of basically start at the top of the head and work our way back down. The third thing that we need to have is the correct equipment. This is, of course, a pleximeter. Some people call it a patellar hammer, but it's a pleximeter. And this is useful to evaluate the spinal reflexes so you can really get a feel for what's normal and what might be hyperactive or depressed. The second piece of equipment is a pin light, so we can evaluate the pupillary light reflex. And the third thing is a hemostatic forceps, which are going to help us test sensation and the panniculus response. So once we have our equipment and our form, now we can actually begin with the testing.